Hi, welcome back. It's Dr. Jennifer Neff, and today I'm going to talk about urinary tract infection symptoms. This was a request from one of my patients in the office. I was talking about my YouTube channel. She said, "Oh, you need to talk about this because it would be really helpful for people to come and get a little bit of information before they decide that they're going to go to the doctor, or see if there's something that can be done before going to the doctor to get some care for urinary symptoms." Now, when I say urinary symptoms, first and foremost, I'm thinking about women. Now, there are urinary symptoms that men experience, and when they have a urinary tract infection, it's often quite obvious. They will simply pee clots of blood. Yes, I said it. And so the men will come in and say, "I'm having a urinary tract infection." I'll say, "I totally believe you." Now, note to the guys under about the age of 50, if you burns when you pee, that's probably an STD, and yes, you should go see your doctor. Okay, now back to the women. Women will often have symptoms that are kind of pre-concerning, like maybe I should worry about it, maybe I shouldn't, I'm not really quite sure what I'm experiencing. But the typical symptoms of a urinary tract infection are going to be burning with urination, urinating frequently, sometimes 10 times in an hour, an urgency to urinate, and although it's embarrassing to have it happen to you, it does sometimes happen. You get accidents, and that is when that's totally out of the norm for you, then you need to go and see your doctor and get that checked as a urinary tract infection. So the next thing that I will say that really does delineate a urinary tract infection from other infections in the area, like a vaginitis type infection, would be the urinary tract infections have more burning at the end of urination. Now, anybody who's ever had a UTI will know there's that funny little burning thrill at the end of your urination, and then you're pretty much like, "Hi, can I get an appointment with Dr. Neff?" Or obviously whoever your doctor is, urgent care, whatever, get it taken care of within the next 24 hours, otherwise you're going to be distracted and miserable. And we don't like these to progress to things like kidney infections, which is the next possible outcome of a urinary tract infection that is not treated. And that's where it starts getting a teeny bit scary, because younger people, and I'm going to say 50 or below, getting a kidney infection will get vomiting or nausea, pain in the flanks, which is like the upper back area, or total abdominal pain. You can get a fever, you can start feeling really sick. That would be possible symptoms of a kidney infection. It needs to be checked by a doctor. And then in the older age groups, especially over the age of 70, sometimes people with a urinary tract infection that's gone too long will just get loopy, like not losing your keys loopy, but like unable to articulate and just changing personality and just not well. So that would be a sign or a symptom that you would get a little concerned about. So if grandma or if mom is starting to all of a sudden not make sense, feel slow, complete change in personality or whatever, or laying down and sleeping when they don't normally do, first thing we check for is a urinary tract infection. Okay, now moving into not urinary tract infections, but vaginal infections. And so this is a reality for women. I hope the men have stopped listening by now, because they probably don't want to hear this. So the reality with a vaginal infection is it can burn throughout the entire urination, or you can have itchiness in the external vaginal area, you can have discharge, and these are things that you need to tell the doctor about. Because if you go in and you declare you have a urinary tract infection, then sometimes everybody will be led towards urinary tract infection. We'll look at the urinalysis results and say, "No, you don't have a urinary tract infection," and then all of a sudden you're scooted off home when what you have is a vaginal infection and you needed to get cultures for that, and now all of a sudden you bought a second visit, which is no fun. Okay, so antibiotics are frequently used to treat urinary tract infections. What I have found is that if you are having early symptoms of a urinary tract infection and you don't have a history of kidney infections and you're younger than 50, it is safe to increase your water intake, like 2 liters of water a day. Take some cranberry pills, because the cranberry pills will acidify the urine. You can also do lemon water. Some people would do a over-the-counter supplement called D-Mannose, which helps the body kind of rid itself of bacteria. If those things are not working and you're still having your symptoms, then it's a good idea to go in, get a urine sample done, and then talk to your doctor about that. Now, vaginitis symptoms, as I said, discharge, burning with urination, those things, they will sometimes be at a low level when you're having that kind of funny, not so fresh feeling. And if that is the case and it's been going on for a couple of weeks, or you have your cycle and that doesn't clear things up, then that would be another reason to go in and just get that checked out. So for the imbalances that can occur because of antibiotics. I always recommend a probiotic after an antibiotic is taken. Sometimes a probiotic also is nice to reset some of the normal bacteria that tend to thrive and live in your vaginal area. We've got gut bacteria, we've got vaginal bacteria, and those can be reset with probiotics. Now, I'll mention in the comments section what I recommend if you're interested, or you can come in and see me if you live in Southern California. Just kidding. Okay, I hope that you've learned a lot about urinary tract infection symptoms. I hope that you've learned a little bit about the things that should get you to the doctor, definitely, things that you can do before you go to the doctor, and things that you should be very, very cautious about. So that's it. Until next time, bye.